Have you been thinking about spaying your dog and you heard about laparoscopic spay? Is there any benefit to it, and apart from higher price, are there any disadvantages? Well then this video is for you. I'm Tereza, I'm one of the directors here at Warren House Vets, and in this video I'll summarise 5 things you should know about keyhole spay. Keyhole surgery has become the gold standard in many human operations, and now it's being offered to our furry friends too. You would think if it's good enough for us, it should be better for them as well. Well, let's take a look. The first thing you should know is the difference between open and keyhole approach. Open approach is the conventional method of operating via a large incision on the abdomen. Laparoscopic procedures are frequently referred to as keyhole procedures. Keyhole approach is a minimally invasive technique performed through 1 cm small incisions. Keyhole surgery has many advantages over open surgery, so let's take a look at those a bit closer. Firstly, recovery is much less painful after keyhole surgeries compared to an open spay. The majority of the pain comes from the size of the incision on the abdomen itself, so the recovery, just like in humans, is much quicker after laparoscopic surgeries. Your dog still has to be rested for some time to prevent complications, such as hernia, but overall you will get a much happier girl straight after the surgery. Generally, keyhole spays carry a lesser risk of surgical complications, which is down to several factors. During laparoscopic procedures, the view is captured on the camera, which offers a magnified image, making it much easier to see for the surgeon, and even in challenging patients such as dogs with obesity, the picture is much better. Surgically, it is also less challenging because vets tend to remove only the ovaries during keyhole spay, leaving the uterus behind. Now, you may think that this is a bit risky, but studies have shown that the risk of uterine cancer or pyometra is negligible, and once the hormones are taken away, in other words the ovaries are removed, the uterus doesn't really pose any future risk. We can perform both types of spay, simple ovariectomy where we just remove the ovaries, as well as ovariohysterectomy where we remove the ovaries as well as the uterus, but majority of clients choose the simple ovariectomy. In general, when vet practices offer a lap spay, it means the ovaries alone. Well, just like with everything in life, there are some disadvantages. The advantages, however, outweigh the cons by far. For example, keyhole procedures carry a lower risk of injuries, but when the injuries do occur, they tend to be identified later. So not typically during surgery. It's down to the fact that the injuries, particularly for example using electrosurgery, can occur outside the field of view of the camera, and therefore it escapes the awareness of the surgeon. Another disadvantage is that keyhole can take, particularly when the surgeons start with it, 2 or 3 times longer than the normal open surgery. That means that the dog is under anesthesia for much longer. Prolonged anesthesia, particularly in older animals or animals with comorbidities like obesity, diabetes, etc., carry high risk of complications, including anesthetic death. Laparoscopic spays tend to be more expensive. The equipment is very specialised, and even when you do have the equipment, even when the practices invest in it, it takes a lot of training for staff to implement the new service. This is the reason why keyhole spays tend to be priced £150 or £200 above the normal open spay prices. Most of the talk was about laparoscopic spays, but we can also remove retained testicle through keyhole approach. We are also just introducing a gastropecty, when we stitch stomach to the abdominal wall to prevent gastric dilatation and volvulus, which is a condition that can be fatal, particularly in large dogs. We also perform lap spays in cats and very small dogs of less than 5 kilos. This requires a different set of equipment, a specialised smaller tilt table. That is possibly why many practices limit their laparoscopic space offer to mid-size or larger dogs. So in summary, laparoscopic spays and grip tourniquet removals are overall safer and less painful way to neuter cats and dogs. It is generally more expensive, but as one of our clients pointed out, they just get neutered once in their life, so it's just one payment and it's not that bad. We hope this video has given you a better understanding of keyhole and open spays. Let us know in the comments what other topics or laparoscopic procedures you would be interested to hear about, and see you next time!